Welcome, everybody. I'm Aaron Neinstein. I'm Chief Medical Officer at Notable and very excited to kick off our 2024 webinar program in conversation with several visionary executives that are joining me today. So I'm joined by Erica DeBoer, who's Chief Nursing Officer at Sanford Health, by Crystal Broge, who's Chief Digital Transformation Officer at Medical University of South Carolina Health, and by Lene Robeson, who's CFO at Medical Associates Clinics. We'll discuss how they've transformed their digital front doors to collectively serve millions of patients, caregivers, and support staff alike. Health systems may face a challenging year in 2024. We're seeing aging patient populations, new market entrants that are dominating news headlines. We're seeing continued workforce challenges. And at the same time, these challenges can present new opportunities for health systems to accelerate growth, to build resilience, to reimagine new ways to serve and support patients. And health systems have been working on their digital front doors for a few years to help address these types of challenges. So I want to dive right in and ask the first question here about what's your vision for your organization's digital front door, and where are you on that journey? So Erica, I'll start with you.
Thanks, appreciate it. I think my vision for what the digital front door looks like is frictionless and ever changing. I don't think that we're ever going to be done with actually creating a digital front door that serve our patient populations. But what does great look like? Frictionless.
Yeah, I agree with you, Erica. I think that getting patients to the right place at the right time with the right provider is the ultimate goal of a digital front door, and showing them all the options, whether it's in-person, virtual, whatever type of care they need. But I agree with you. I don't think we're ever going to be done, because there's always going to be new technology and new opportunities to engage those patients at a higher level.
Agree as well. Our goal is we want to be the leader in our community for patient self-service tools. We know that our patients have been asking for these things, and agree with both of you that we're really just getting started, and who knows where we'll be. AI and automation is really just getting started itself. So it's probably just a drop in the bucket of what will look like years and years from now.
I'd love to double click into that a little bit more. I mean, I love this idea that the digital front door is not a destination, that it's a journey. It's a term that we started hearing more of over the last 10 years. What do you think are some of the waypoints that we, as an industry have succeeded on over the last several years, and where we're going over the next 3 to 5 to 10 years with digital front door?
I think showing more transparency into the availability of appointments and the appointment types that are available. I think, and originally we just had, the online appointments that were open, but now we're able to show more, able to show virtual, able to show different time, place, be able to tie it into, show me appointments within 5 miles of my house, 10 miles of my house, and if I can't see this provider, could I see an APP? And really starting to dive into that is some of the things that I think is super important for our patients.
Well, and I think our patients expect it. When you think about all the other different consumer-driven products that are out there, we have to start leveraging AI to make it easy for our patients to know what options they have available.
Yeah, I think you're both hitting on such important points. I was on an airplane yesterday, and now even my bag, as you check it in, they tell you exactly where it is. So that same level of visibility and transparency has got to make its way into healthcare for people.
And Aaron, I'll add on to that, ease of use, right?
Yes.
How easy was it for you to find that? How easy did they push that to you to say, hey, your bag is here now. Click here if you want to see more. If we could push, hey, Erica, you need this type of an appointment, please push here so that you can, create that. And some of us are already doing that. So that's kind of the really exciting point that we're getting to in healthcare. We're sort of catching up with other industries.
I love to say that you said catching up. It's really so that we can stop reacting and start being more proactive. And I think that's what all of us want ourselves. but our patients need it as well. If you look at our aging population, we have to try to figure out ways to connect and engage with our patients in an intuitive way.
Absolutely. So let's talk a little bit about how and why each of your organizations, which you're all very different across the spectrum of healthcare delivery organizations, how are you using Notable to engage patients in a more modern way that's digital first, that's intuitive, intelligent, with minimal friction? And so, for each of you, why was Notable a necessity to meet patients where they are? Erica, let's start with you here.
Perfect. Thanks for that, Erin. I think we started with really a workforce problem. So our patient access teams were really at an all-time low when it relates to the number of individuals that were available to do the work the way we'd always done it. And because we had limited resources at the front desks, we had to figure out a way to serve our patients. So we engaged with Notable in order to do our digital registration. And then more importantly, we took it to the next level to try to figure out how do we actually reduce the friction for our frontline teams through clinical intake. And I'm so excited to share really how seamless, yes, lots of work, lots of time, lots of intensive conversations up front to really get it right. But through the use of Notable, we've been able to engage with 1.5 million unique patients with a 50% digital experience completion rate. We've seen no-shows decrease with that completed experience with Notable. But more importantly, we've been able to reduce the friction for our frontline teams as well by using our HL7 interfaces with Epic to actually document the information that our patients have actually shared with us about their depression and anxiety screening. It's really exciting work to see.
I think we're kind of following down pretty much your same path at Medical Associates. We just started this past summer, really diving into this and kicked off first with digital registration. And the key driver for us is really to give our patients what they've been asking for as far as digital tools and to improve our patient satisfaction and just the customer service that we were providing at the front desk. We had awful phone abandonment rates for the same reasons that you talked about, just the workforce shortage and getting people to, there's really too much stuff we were asking our teams to have to do at the front desk, and that no one could do it all well. So we kicked off on a phased-in approach starting last fall with a few departments, and we've slowly brought it on. We're about 80% deployed now with our registration intake. But we actually are seeing from start to completion rates of about 65%, which is, I think, is pretty phenomenal. We're pretty excited, and the patients love it as well. So we have seen improvement in our patient satisfaction and our phone abandonment rates, definitely. And I'm not seeing the lines out waiting to get up to the front desk for their turn. So
yeah, I think that patient satisfaction with the experience is key. We see 97% of thumbs up at the end of the experience, which is really exciting. So, and we have similar numbers, 110,000 registrations a month. We figure is that frictionless piece that Erica talked about, that it saves our front desk person. For everybody who registers online with Notable, about 3 to 5 minutes is saved at the front desk. So that's about 7 hours a month per department that we have on Notable that lets that person who would normally do that do something else, refer people into the system, spend more time with the patients, helping them with a problem that they didn't have the time before. So it's definitely, making a more seamless and frictionless experience.
Yeah, I hear that theme echoing in all of your comments that, historically in healthcare, if you want to serve more patients or improve satisfaction, you have to add more people, more effort, and the ability to serve patients better and improve their experience while also reducing staff effort is a pretty exciting opportunity.
It is. It's been really amazing to see from start to finish. We have lots of really great comments from our younger patients, but more excitingly, some of our 70 and 80-year-olds that in some cases we think it might be a barrier for them to connect virtually. They actually felt like it was pretty intuitive. And of course, that's what all of us are trying to figure out is how do we make it easy, intuitive, as well as then connect with the patient and their story so that we can care for them the best we can.
Yeah. Now we have a few different EHRs represented here. Maybe Lene, I'll start with you. You're on Cerner. Can you tell us a little bit about how your EHR influences how you're thinking about your patient engagement tool set? And then we'll go on to Epic.
Sure. Yeah, we use Cerner, and as we kind of started down the journey of wanting to get into the digital registration and add AI and automation tools, we just weren't finding things that worked really well with Cerner. Cerner doesn't have much on built into Cerner, so they have a lot of bolt-on tools that they use. So it might be a different one for basically the spectrum that Notable is offering or what their vision looks like. Cerner was using 7 different companies to each take a piece of that. So that's why we got excited about Notable. And we had great referrals of people that had gone before us in Cerner. So just knowing that other customers have been successful with Notable using Cerner was key. When we first started engaging with Notable and we're just kind of learning what it is you do, we were amazed. Our IT director actually said, I think Notable knows Cerner better than Cerner knows Cerner. Just because they're able to speak the language that most people haven't successfully done that we've worked with in the past. So Notable has made it easy for us and has helped us see a long-term vision that we were kind of struggling to figure out how this would work with Cerner prior to this.
That's great. And Crystal, do you want to start touching on the Epic side?
Yeah, we're an Epic shop here in South Carolina. And, while we have MyChart and MyChart's great, not everybody has a MyChart. Not everybody has MyChart password, remembers their MyChart password. And so that became a blocker for us. And so one of the reasons we went to Notable was to see if we could engage more patients. And we did just that. We went from 25% to 44% of patients that now fill out a pre-registration experience, which is a huge amount. And we collect probably 5% more copays now than we did before patients even get in the door. So being able to have that and being able to change, and we'll talk a little bit more about this, Erin, nimbly and learn from what we've done and move forward. We've got some real good successes is how fast we've been able to do some things and make a huge difference in the lives of our patients.
Thanks. And Eric, any reflections?
Yeah, absolutely. From our perspective, it was really speed to execution. That was something that was really important. We're an Epic shop as well. We've been part of Epic for years and years, so we have a lot of customized flow sheets, a lot of customized workflows. And so by partnering with Notable, we've been able to really revisit some of those old workflows that maybe met the need in the past, but now how do we reimagine how we do our work differently so that we can actually accomplish some of those bigger goals? So to Crystal's point, although we've had lots of great engagement with patients, we also have increased some of our copay collection as well because we create that frictionless experience on the front side. Plus, if you think about how important it is, our employees and their work and their engagement in the work, our employees at the front desk don't love to collect money at the desk. And so how do we allow our patients to do that ahead of time? So again, we can focus on those things that are most important to them in the moment, which is making that connection, helping them navigate some of the other complexities of their care.
Yeah, that's really wonderful. So, going down that path of thinking about the patient experience, we mentioned earlier that you do have very different organizations across the three of you. You each serve very different patient populations. We've got rural pockets, we've got underserved markets, we have academic medical center and the specialty care that comes with that. There's sort of been a long-standing assumption, I think, that digital doesn't work for certain patient populations, that only, millennials, only Gen Z, only urban patients really want to use digital. I think you all have really interesting perspectives and stories on this, and so would love to hear you reflect. Maybe Crystal, I'll start with you on how your digital first approach has impacted or improved health equity and access to care, what adoption has been like among different patient populations for you.
Yeah, I think that big thing for me is that we were able to start sending out our notable announcements in Spanish. We could not convert MyChart because just like Erica said, we had a bunch of stuff that we've done, behind the scenes in Epic that make it very difficult for us to set up MyChart like this into Spanish. And so, but to engage our Spanish speaking populations, we were able to very quickly, in like 6 weeks, put together our notable, and this was a total wow factor, and start sending. If you are a Spanish speaker in Epic, you get your notable in Spanish. And we saw them engage quickly with that, which was exciting. So we were engaging a whole new population. But more than that, as we talk about those patient satisfaction, we started getting messages back from our Spanish speaking patients in Spanish, telling us how useful it is, how easy it is, and thanking us for engaging them in this way so that they could work with the health system in their native language, which was very exciting to see.
Yeah, that is incredible. Lene, how about at Medical Associates?
Yeah, our goal is we're in Dubuque, Iowa. We're not in a population that's growing, which means we're aging, and we want to be able to draw in the younger, population to make sure that 20 years down the road we still have a patient population, right? Having the digital tools, I think that our highest use population is really in the 40 to 55 crowd, I would say, who are engaged about 80% start to finish. But we do have a large pocket of the Medicare age patients that are using it as well. I think it drops down. It's probably about 40%, but it's like 40% of the plus 85-year-olds are doing this from start to finish. That's one where where patient satisfaction drops a little bit on the dashboard that we see. So we can see the comments on Notable of what they're telling us. So we're trying to work with those and what's making them not like this, because we probably can bring that up with just small tweaks. One of the things that our older population struggles with are the consent forms that we have out there that it's a little more clicking. I think that population isn't as used to those, so they think they have to read verbatim word for word, and I guess they should, but most people probably don't. But just small tweaks that we can do in our experience, we think we should be able to bring that satisfaction up a little bit. A comment that I had that was actually pretty cute from one of I think it was like an 80-year-old person that said, I thought this was easy. I have a really good, but I had a good experience with it, but I think some of the elderly could have trouble with this. And I think that's just kind of,
I love
there's
that.
all kinds of perspectives, right?
That's awesome. And you also hit on that same theme of digital being a journey, not a destination, right? Because the ability to collect engagement and satisfaction data from different segments of the population, understand them uniquely, something you can't do in an analog world. It allows you to get insights and to iterate and to deliver unique experiences to those different population segments. So yeah, love that story. Erica, any reflections on this one from you?
I would love to just share a couple of the ahas. I think so often we get so used to speaking not only in their language, so that patient access, that payer feedback, and just the language that we use, that by going through this process, by really thinking about it from the patient perspective and getting that instant information from our patients, we were able to tweak some of the language really easily, which again, that gets back to iterative processes, that gets back to agile, and that fast action, that how do we partner, how do we make a change? And in just an hour, we can say, this is the language we're gonna use instead, and then we can actually see the engagement change, and then we can tweak it again. Now that's a very different way of thinking. Lots of us in our Epic workflows are used to waterfall processes. Agile was different. And so by using this, by having that instant feedback from our patients as well as from our frontline teams, it's some of the transformative work that we were looking to do, and we can't wait to continue to iterate and learn more.
I'm gonna second exactly what she said there. I think our teams were very surprised during our journey with Notable just how agile it is, because we haven't seen it before. Working with Cerner, and it might be something that, you know, you identify a change that needs to be made, and it could be months before you can actually get that to happen. We're working with our implementation team that, you know, they know who we are. We're with them all the time, and we identify something and they're like, oh, I got that. I passed it on to Stan, and Stan put the fix in, and we can see it right there that very day. So it's pretty powerful just how quickly things can and do happen.
Yeah, it's so true. Digital is also a mindset, right? So as you're able to collect detailed, you know, discrete data about different patients and their experience, being able to respond to it rapidly and iterate becomes so important. So yeah, love those anecdotes and stories. So you know, we're all very dialed in to improving patient engagement and patient satisfaction. As health system executives, you do also have other hard metrics that are tied to your digital front door initiatives, no-show reduction, capacity, patient access. I'm curious, what other KPIs are you each tracking to measure impact across these digital front door initiatives? Crystal, let's maybe start with you.
Yeah, I think you've hit the big three that we were looking at when we first brought in Notable. It was the copay collection, it was the number of pre-visit check-ins, and then our no-show rate, which went down about 7% by using Notable. So for those departments that are using Notable. So, you know, people feel a little more engaged when they have the option to confirm or cancel at the right time. And canceling is not a bad thing, right? You can always turn on the Epic Fast Pass, and then those appointments get redone and booked back up again if someone does that, rather than being a total no-show. So it's a win-win all the way around.
Lene, hard outcomes that you're looking at?
Well, we're still pretty new in the process. Those three things, of course, are on there. The other ones that we're watching are cash collections via prepayments and copays. And just I echo exactly what Erica said, that people at the desk just don't like to ask for money. So it's much easier when it's just your phone that's asking for money. So we're new on the stats. We've seen some uptick on that, but definitely a long way to go there. And then also eligibility and denial. So we're capturing the insurance card, and if the patient takes a photo of it, and then using AI to scrape that card and fill in the right buckets. So you're training the computer to do things without error that previously you had 100 different receptionists interpreting what they're seeing on the card and hopefully putting it in the right box. So our long-term goal is to have even better or lesser denials insurance-wise by capturing the information by digitally versus by a human.
Yeah, I think maybe the only other two things that I would add, no-show rate is really important, but I want to identify the difference between what we see with a regular no-show rate of about 5% across our 300 clinics to if they start the digital experience and they complete it, we've been able to decrease that no-show rate to 1.5%, which is huge. So if you think about access, when you think about rural, when you think about some of the challenges that we have with weather, especially this time of year, the opportunity for us to minimize some of those no-shows because of the frictionless experience, and more importantly, they've engaged. So we're going to welcome them, and we're going to make sure that they get the care that they need once they do arrive. So that no-show rate's been something that's really important to us. I think, as I mentioned before too, clinical intake is one of the secondary benefits that we've had to Notable. We've had a lot of really great engagement from all of our frontline teams, and more importantly, our ability to capture depression screening. We also know how tough it is to have these conversations with patients if you start and you ask the question multiple times at multiple different ways. So by us inviting them to complete the clinical intake experience with depression as well as anxiety screening, the conversation's already started. Then it's all about connecting them to the right resources. So how I actually have been so proud of our teams engaging with this tool is it helps us actually meet the needs of the patient in a more effective way. It's been really exciting to see.
That is awesome. I am curious also, just double clicking on this question about hard ROI. We have three different executive roles reflected here. We've got a CFO, a chief digital officer, and a chief nursing officer. How are you all thinking about aligning the C-suite and the entire executive team at your organizations around the ROIs and the business cases for your digital front door initiatives? Any particular challenges or opportunities or advice for people there?
I think sometimes it's hard. It's, transformation is an ongoing iterative process. So it's hard for them to look at it and go, okay, well, what is our bottom line savings? How many jobs can we, redeploy or do something with or whatever? And sometimes it's, it's got to keep up with where the world is. We need to transform, and we know that things will come, but sometimes it's a softer thing too. Sometimes it's the restoring joy in the work of the people at the front desk, at the physicians and stuff, by having the right information at the right time so they can do things and move forward. And so that's conversations that we have that are still challenging. But we're definitely working towards that there's more to it than just the super hard ROI.
Well, and I think we have to, right? That the low hanging fruit is gone. I think all of us know that. And so certainly we've been able to leverage some of the FTE savings and then refocus their efforts on other things. But more importantly, it's that joy back in the work, as well as efficiency and time saved. In some cases, back to your point, Crystal, if we can save a couple minutes per individual, per check-in, think about what the attribution strategy is to that too, because we're reducing the friction, we're making it easier for them to come into our clinics and see us, or get them connected to the right resources, which might not be having to come into the clinic. It could be a virtual visit or something other than that.
But it's something you have to teach, because when they see that you save 7 hours a month, well, that doesn't mean we can let Sally not work on Friday. We still have patients coming in on Friday. So what's Sally doing with that extra time? We can have her do referrals or some of that other work that you've talked about.
Yeah, we've really used it to, like you guys have alluded to, just really look at our processes and what our folks are doing, and learning more about, they've had a lot of add-on work at the front desk that they're, picking up these things that they were doing to help out clinical. We know that we have a lot of our clinical teams that are doing a lot of clerical work as well. So we're finding ways where we're freeing up time because they're not doing as many check-ins, so that they can do some of this work that the nurses previously were doing. And it's kind of getting things into the right level of work to be doing it. So we're not looking at it either as this is a huge, we're going to reduce our FTEs by X. We do think that we will get that through attrition. I'll tell you, as we started to deploy this, our frontline staff were very nervous. They're what are they going to do? What's going on here? What are they looking to do? They're not going to need as many of us. They can kind of see that. And we did hold some jobs open for a while at the beginning, where we had attrition with our reception teams, because we didn't know what the end state looks like. And now we are starting to post again, and they're kind of all going, but we have been, we're not filling as many as the last few that we lost, because we are, finding that the need isn't as great as what it was. And with some redesign, we can just make improvements in workflow all over.
I love that. One last thing, and I might add, Erin, if I may, is the
Please.
picture's worth 1,000 words. So if I could share a picture, it's throwing away the paper forms, right? So I had some of our patient access teams just be able to throw forms that now they don't have to find, they don't have to make another copy of. Pictures worth 1,000 words. Is let's throw away some of the waste in some of the paper processes.
And that's a learning curve, isn't it? I mean, front desk so used to doing that over and over and over again. I think we found that we had to really work with our front desk staff. No, you don't need to give them the clipboard. You don't need to give them the clipboard. Check and see, is it notable? Has they already checked in with notable? Then let's leave it there. You don't have to give Mrs. Hanson that. You can give, just have her go and sit because she's already checked in. And we're still even working on that in some processes. It's sort of that change management that has to go along with this type of digital transformation that's really important, is actually making sure that everyone along the way understands what's happening in that process and what's going to happen going forward.
Yeah, I remember when we first went live and our training team was like, wait a second, we haven't trained our people on this. We're not ready to do this. And it's like, oh no, you're not training them on something new. We're training them on what not to do. So it's a whole different mind frame on what it looked like before.
I'm envisioning like a trophy case in each of your clinics with the clipboard. You know, date of clipboard death 2024. It's
Yeah.
a historical artifact.
I love it. We do have a museum, so we might as well just add it to it, right? I love that. That's a great idea, Erin.
What thoughts do you all have around, the impacts on the staff and Lene, I mean, you said it best, you're taking work off of staff's plates. How are you messaging that with people? How are you building enthusiasm for allowing them to focus on, why they got probably into healthcare in the first place and building joy and enthusiasm around their roles and how they're changing?
I think from my oh, go ahead, please.
Well, I was just going to say communication is key throughout the entire process, keeping the staff, the physicians, the management teams all engaged in understanding what we were doing. Just lost my train of thought here. I'm going to let Erica go. Go ahead, Erica.
Yeah, we'll come back.
Perfect. So I think leaning in, right? So we've had some really great success. So how I've used and started to leverage the tool is how do we make sure that we understand what's the friction that our frontline teams are experiencing? What are they hearing from their patients? And then how do we use that to actually identify what our next steps are? So the excitement, you got to use that excitement to continue to build that and make sure that we're thinking about what is the other work now that you can do? What other joy can we add back to the work? How do we actually engage with our patients differently using some of our higher reliability sciences and some of those pieces too? It's really exciting to see really the engagement and the empowerment of our frontline teams, but you got to ask, you got to get boots on the ground out there with them to help them understand how much we value each one of their roles. I think the second thing that I would add is this chance to really look at the skill mix in each one of our clinics and really identify how can we work differently? How can we serve patient populations differently? How can we actually address the needs of our rural communities potentially in a different way?
Yeah, we've used some of our employee surveys that we've had too, and to identify the things that, they didn't like about their jobs, exactly like you talked about, and have been able to redesign our positions so that it's like, you're right. That doesn't make sense for you to be doing. So let's put it where it makes sense. And that was too much on this side. So let's allow you to focus on what you're doing and framing that with that team that, see, this really is, it's not removing, things from your job. It's making your job better. And they're now beginning to see that as well. So
yeah, if I were to go back, go ahead. Go ahead, Crystal.
No, go ahead, Erica.
Sorry.
No, go ahead.
Well, I was just going to say one last thing about the training piece, Lene. I can't even begin to tell you how much over we've been in mode of implementation. You have to have a full education communication plan. It's not really about education. Yes, communication is key, but it's the change management on the front side and the back side, right? To maintain that standard. So technology can only go so far. You got to have the right people and the right processes in place. So we've said it multiple times. I don't think I can say it enough, is the redesign of our workflows is possible when you have the right tools in place. But then you got to keep interestingly enough, it was with Notable and our rollout to well over 200 departments for depression screening that we actually didn't do a whole bunch of in-person sessions. Short CBT to talk about what they can expect. And then that was it. That was all we did. And guess what? It was the smoothest go live we've ever had. We had one ticket, one in 200 clinics. That's really, really very strange to even say that out loud. So we're really excited about what it means. But the key is it's digital transformation. It's transforming how we do it to a very intuitive way, so you don't have to educate towards it. If we make our situations too complex, then we have to communicate and educate differently towards it. So it's exciting to see how you can actually just transform it if it makes sense. So Crystal, I'll kick.
Yeah, and I agree with, as much as we look at our teams and see, you know, where care team partners are doing, and continuing to ask, how's it going? How are we doing? We're doing a survey right now of our care team partners. So I'm really excited to hear, you know, after almost a year of Notable, how they feel about how it's going and where we could go next. We also do the same thing with our patients, right? We look at the scores and those reports and things, and we're very nimble. We started seeing patterns of what people are asking. Why are you asking me the same questions over and over? Why do I have to keep doing this? And so we went from entering all this information to here's the information that's in Epic, review it and say if it's okay, or go in and change the piece that needs to be changed. We have some patients that are frequent flyers that come a couple times a week. So they were getting 2, 3 notable notices saying, hey, you know, pre-checking for your appointment, pre-checking for your appointment. And we got a lot back going, I have multiple appointments. I'm getting this all the time. Why can't you just carry it across? So we started bundling our appointments and having one notification going out for whatever you have that week. You could check it, push the button once, check in once, and huge patient satisfier too. We didn't have to teach them that it was different. They just saw it. We just put it out there and it just went. I think, and that was truly a wow experience for a lot of our patients, and super exciting.
And Lene, I know you touched on earlier similar concept about moving towards this more agile, iterative approach in deployment that Crystal was just touching on. Any further thoughts there on how you've led medical associates and the organization through that mindset shift to iterating and being more agile?
Well, like I said, communicating on every step of the way, so that people were aware of what was coming. Also, including several levels in the project team. So our reception managers were key into this. It was, you know, the registration intake was led by our rev cycle director, but our reception managers are really the ones that helped us get it right. And also were the ones one-on-one with their team members, helping them what to expect and how to work through that change process. As we went into it, we also leveraged our marketing team a lot to engage with the patients to let them know what was coming. People are leery about clicking on a link in a text message. We tell them every day not to do that. So why should they do this now? So getting information out that it was coming, having, you know, flyers on our desk, this is coming. We also, as we transitioned from we still had a phone reminder process and a text reminder that looked real old school, like 1980s-ish. And as we took people off of that, when the notable notifications started coming, we sent an email. We have a list that we're tracking that who's had a notable reminder before and who hasn't. If you haven't, a week prior, you get an email pretty much explaining step by step what's coming. And I do think that this has helped us and get pretty high interaction right up front, because it gets them comfortable that, yep, I was supposed to get this text, and kind of talks them through a few of the things that they could have questions on why we're doing that type of thing. So I think all of those things have been important and in us getting pretty high engagement from the start.
Crystal or Erica, any further thoughts around process, agility, training your organization there?
Well, I
It's
think
taken
really
us some
important.
time. Oh,
Yeah,
please go ahead, Crystal.
You know, we used Notable for a different area altogether. We decided to do a care gap outreach, and we decided to start with mammograms. So Notable will go through and go, have you had a mammogram in the past year? If not, send you a message saying, hey, Lene, you might need a mammogram. Can you can click through and then it's scheduled right away. And so he turned it on and patients loved it. And we let our staff know, but we were not as good about notifying our staff of what could happen and how this would happen. And in 2 weeks' time, we scheduled 874 mammograms across the state, which is fabulous. And we were very excited. But one of our hospital locations started calling going, something's wrong with your Notable thing because it's scheduled 200 mammograms at our facility. We've never had that before. We can't handle that right now. Like, no, you have the appointment slots available. It's okay. I think it's wrong. We had to go through and verify that, yes, every single one of those were patients that clicked and said, yes, I wanted that. But also to do the follow-up afterwards, they didn't have that much volume, so they didn't need the follow-up. So we had to reorganize their workflow in order to be able to handle that going forward. A good problem to have, but still something that probably should have been a little bit better communicated on our part. And we're certainly learning through that process as well.
Great point, Crystal. Our partnership with our operations has been key to all of this and really engaging our frontline directors and frontline teams to help them understand, as well as have them help inform us. What's going to be the thing that's going to reduce the friction the most? Where is that problem that we're trying to solve? And then how do we? I think the other piece that processes helped us do is really think about things from a different perspective. We have a tendency to solve the problem in a firefighting mode, right? We don't have enough people to do the patient access work. Let's solve this. Well, let's step back now and think about, what does clinical intake really mean? Could it mean all of your pre-op forms, which might have been done via a clinic visit? Well, do they need to travel 3 hours from their rural community to us to do that pre-op visit? Or could we do some of it via our digital registration and clinical intake, and then a video visit or e-visit to help support reduction in some of that travel and really that friction? So it's not just about digital, it's about connecting them to the resources in some cases. So it's been fun to help our teams understand what it means. And then also to challenge ourselves, to speak up and say, what is best practice? Is this all that we've known? Is this the only way that we can do this? Or is there other ways in the industry that we could challenge ourselves? So it's been fun to challenge as well as navigate through the change of what our people need.
Yeah, so in our last few minutes here, we're going to ask you all to reflect on sort of a future looking question and then a retrospective looking question. So maybe Erica, I'll stay with you. As you think about this digital front door journey going over the next few years, where do you see it's January 2024 here, so we've got to talk about AI, right? So where do you see AI as helping unlock new capabilities for your digital front door or accelerate new capabilities for your digital front door?
A really popular statement from me, and I'm sure you guys have heard me say it before, is how do we get rid of stupid stuff? So I see AI helping us actually reduce some of that non-value add work for our frontline teams, as well as our patients. So how do we anticipate that patient persona? How do we use AI to help us actually understand the journey that our patients already been on so that we can serve them in the moment and not have to ask all those questions again? So AI is going to be vital for us to get more efficient and to use all the amazing data that we have within our electronic medical records.
Lene?
Yeah, great thoughts. For us, as we're just getting started, the next things that we've really looked at are potentially using a digital assistant on our website to pull the information out, be able to answer the questions for patients without them having to dig into the details of the website. If we can basically feed it up to them, that would be great. Also looking at using things kind of like Crystal, you talked about with your mammogram program, population health, the pre-authorization process, that would be a big one for us, to be able to identify what needs pre-auth, and kind of, I think AI could really take it through the whole entire journey without it even having to touch a person 90% of the time. So just exactly what you're saying, there's so many places where there's just things lining up in work queues that we need humans to just work through all the work queues, and really 9 times out of 10, they're just clicking a box and saying, this is okay, it's not okay. We can use AI, I believe, to train a computer what's okay and feed up what's not okay. And that's where we need our humans to do the work.
Yeah, I think some of the things we're exploring, and we're exploring them with Notable, is pre-certification. So if you have some test or some exam or something, to be able to, okay, Crystal has XYZ insurance. So go out to the portal, see what's needed, make sure the documentation's there, get that certification code before Crystal comes in. So we know that this is okay to go forward. And even sending her a notification saying, hey, you've been pre-certified for this. Here, now you can click this to schedule. That patient experience becomes so much better. You're not waiting, you're not wondering. The same thing for referrals. If I go to a doctor and they say, oh, you need to go see XYZ specialist, instead of a form being faxed to the specialist's office so that they can schedule you, maybe having that form automatically feed into an Epic work queue for say, and then that work queue is worked by Notable or whatever. And then a message comes back, goes, Crystal, here's the availability for doctor specialist. Click here to schedule. That ease of use and making it much more seamless for patients, I think, is where we're going to see a lot more work in various levels of AI, not just the generative, chatbot type thing, which lets it be on 24/7 and gives much more expansion for patients and much less stress for our staff.
So nobody said that AI is going to replace the doctor yet. Thank you.
No. We still need you, Erin.
No, well, we still need you, and it's a high touch it's a high touch profession, right? And so we're not going to replace, but how do we enhance and bring that joy back to the work?
So let's, in the last few minutes here, let's look retrospectively. You're each at organizations that have really been leading the way on these digital journeys. Let's go back down the line here. Crystal, I'll start with you. Closing advice to peers who are maybe a little bit earlier on their digital transformation journey. What do you wish that you had known a few years ago that you know now?
I think that you have to take it one step at a time, and it's hard, right? This isn't an easy thing. You have to establish yourself with the vendors that you're working with. You have to establish that partnership. You have to make partners across your organization, have IT understand what you're trying to do, and just dig into it and try small and then expand. I think we're really successful with doing things in waves, and that's that whole agile approach. We'll do five sites, then we'll add more, until you send it through the organization.
Lene?
Yeah, agreed. What we've been trying to make sure we're doing is not going too fast down it. We don't want to change everything and jump on every process all at once, because then if something's not working right or satisfaction's not there, you can't tell what piece of it possibly is the one that has caused the bubble. So we're taking a more measured approach, but yet it's actually been amazing how fast we've come. When a year ago, none of us here at Medical Associates was even talking about AI really, and now we're all in. Other piece of advice I would say is just engage with a partner that is with you for the long haul and is seeing a broad vision along with you. I think I get things in my mailbox every single day about, hey, I can do this piece, and hey, I can do this piece. And they're pretty small, probably just companies that are only looking at rev cycle or are not looking at everything that really AI offers. And I'll toot your horn, Erin. Notable's been great. And I think you guys also are on the tip of the iceberg, but always looking forward of what the potential is and where this is going. You guys are always seem to be, 100 steps ahead of the next person. So I appreciate the vision that Notable has really provided me anyway, and getting me from where I was 12 months ago to where I am today, which is nowhere where Crystal and Erica have come. So it's exciting.
It is exciting. So 2 things I would add is fail forward fast. Super important for us not to be afraid, right? Most of the work that we're doing, we learn more from something that maybe didn't go right than something that went really well. And so fail forward fast is something that's really important. And then we can't forget to talk to the people who are using it, which includes our patients, right? How do we understand their perspective? And then how do we understand the perspective of our frontline teams? And then the best products come from there.
Those are wonderful lessons to close on. Thank you so much to all 3 of you. This has been just a tremendous conversation with insights, real world examples, anecdotes, advice for the future. So thank you so much for sharing your wisdom with us.
Thanks for having us.
Thanks for having us. Take care.
Bye.